All right. Okay. Dr. DiOrio, how are you doing, sir?
Good. How are you doing? Good to see you.
Good to see you. I'm doing much better.
You were COVIDed and zombie apocalypse stuff, didn't you?
Yeah, when we first agreed to do this, for you to come back on the show, we were going to talk about some stuff. I had a whole, not necessarily a game plan because I don't ever have a script, so to speak, but I do have some things I like to talk about, especially for people that I'm friends with. A lot of people I've never met before, so it's generally an organic conversation of just as if you met a stranger. But unfortunately and fortunately, ironically for this show, I tested positive for COVID-19 2 weeks ago, and I'm actually out of quarantine now. And it was a hell of a ride and experience for not only myself and my family. For me, I started having like flu-like symptoms, and what I mean by that is I had a little bit of a sore throat and started to have some body aches. Didn't necessarily have a fever, just didn't feel well. Like I felt like I was coming down with something, just not my normal self. And one morning, it was about 8:30, 9 o'clock, I started feeling what I felt like flushed in the face, body was aching, felt very tired. Went home, took my temperature, and it was 100.3, called my doctor, explained to them I was having a little bit of a cough, barely, but a little sore throat and body aches. I said, yeah, come get tested. And sure enough, I did a rapid test, and within 45 minutes, they called me and said I was positive. So then I had to send, my wife and I had to send the kids away. And so it's been she and I locked up in this house, just us. And
Hey!
Yeah.
Oh, no.
Well, so, I mean, we didn't think we were going to get a divorce before this, but we're definitely getting one now.
And COVID was nothing compared to near murder, right?
That's right. I mean, she was upset that I survived. And no, I'm kidding, partially. But one of the interesting things you can hear I kind of have like a sinus congestion and whatnot, and I've been taking some medicine for that. But I think one of the things I wanted to talk about and express was I don't know, and you're an emergency room physician first and foremost, but you also own some wellness and weight loss clinics in North and South Carolina, and we'll jump into that. But and maybe you could explain a little bit of what you're seeing on the front lines of people who are coming in. But unfortunately for me, my doctor said I was young. He said go home, take Tylenol to treat your symptoms and your fever, drink plenty of fluid and try to get rest, and call me if you get worse. And so that's what I did. And my wife came down with it a few days later as well. She had to go get tested, and she was positive, of course. But as I started to progress through this, I haven't ran a fever in a week, and body ache stopped probably 10 days ago for me. But she started to experience a lot of respiratory illness, cough, shortness of breath. And on Friday, she made a turn that morning when she woke up, couldn't hardly get out of bed. And we called her doctor. Her doctor said, go to the emergency department to get a chest x-ray to go from there, because they've told her all that they can do over the phone, and she may need some help. So, we're on a group text message, and fortunately we have a mutual friend who's going to get an incredible bottle of scotch or bourbon from me, who called me in some Budesonide, and that is a corticosteroid inhaler. And I asked my doctor about it when we had a video conference. He said, it's not proven medicine. Yeah, he's read some stuff and seen some stuff on social media and the internet, but can't really do that. So luckily, a mutual friend of ours called that in, and after we gave her a first albuterol nebulizer and then followed with the budesonide, gave her some Tylenol. She lay down. She took a nap. I went and woke her up because I wanted to check her pulse ox and see how she was feeling. She was able to get up out of bed. She went to the bathroom. She was able to walk down the stairs, make herself something to eat and something to drink, and we were no longer going to the emergency department. Listened to her lungs pre-treatment, and they were a little coarse. Post-treatment, she was more open and clear, and her lungs has sounded clear since she started. We both started the Budesonide treatments. She's done a complete 180. It's pretty wild, to the point to where she's now walking up and down the street, up and down the driveway. So if there's anybody out there who gets tested positive, or you get a positive test and your physicians, I would encourage you, if you start to experience respiratory symptoms, I would strongly consider talking to your doctor about the budesonide nebulizer. If we didn't have it, I don't know what we would have done into Friday afternoon or even Saturday. We may have had to take her to the hospital. And she was scared, and I was scared about going to the hospital and what they would have done. So at any rate, that's kind of our story. She's doing better. She's doing great. I'm not saying it's a silver bullet like you see on the internet for everyone, but I will tell you, for the Crouch family, it was a turnaround for sure.
Well, it's after all, COVID-19 is a bronchitis, pneumonitis, and we use steroids often for that.
Mm-hmm.
Does it lower your immune system? Sure, but you usually beat it. Sometimes it's the inflammation of the lung, not necessarily the causative agent. We get, after all, it's a coronavirus. It's a cold virus. So it's not, whether it's budesonide or whether it's another steroid, a lot of those will have a benefit. I'm not sure it's, I think, they're trying everything. They're doing high doses of vitamin C, they're doing steroids, they're proning people or turning them from their back onto their front in the ICUs, they're giving antivirals.
Yeah, it seems like the protocols are changing pretty rapidly the more they learn about this. The interesting part, and I'm not blaming my physician at all, but, he said that he didn't want to do the budesonide because there's no, it's not proven science.
Well, so, why do you want to do the albuterol then? There's no proven science there either.
Correct. So, interestingly enough, he did call me in the albuterol and over the PO steroids. But my point to him was, well, what proven science is there that treats COVID-19? There isn't a whole lot of research and, solid literature that's went through a 6-month trial with a blind study, double-blind study. So, at that point, people will die, unfortunately. And we were just watching the news this evening, and they were talking about, because, we have kids, so you don't really get to watch the news until you catch COVID. But they were talking about how overrun the healthcare system is now because of coronavirus. And, my wife and I looked at each other, and it was like, maybe if we were more on a preventative side, and for those who can be isolated at home before they have to go to the hospital, maybe if they were taking more immune boosting agents like vitamin C, and I'm taking vitamin D and zinc, and maybe if they start to have some respiratory symptoms with cough, shortness of breath, maybe if they could get something like budesonide earlier as opposed to later, that would prevent people from going to the hospital and overwhelming the system. I don't know. Because an anesthesia friend of mine said that they're not doing these so much in the hospital because they're afraid of the aerolization and exposure for the healthcare professionals, doctors, nurses, and respiratory therapists. So they're using MDI inhalers instead.
Yeah. So that's something that we're absolutely not even allowed to do, quite honestly, which to me might be a little silly. Not that it's any better or worse to get it through an inhaler,
Mm-hmm.
versus a micronized aerosol. But the aerosol you do see, I mean, you've seen it when you're nursing days where it sort of puffs out, but so does breathing, so does everything else. So I'm not sure there's been a good study that says it causes, more or less COVID. As a matter of fact, I don't know, maybe you can answer that. You see these studies that say if you wear a mask, it prevents 80% of transmission. I've never seen a study in anywhere in the world that, I mean, where do you do that, Brandon? Where do you put 100 people in a room and put one COVID patient and say, hey, he's wearing a mask? And then in another room, you put one COVID patient that's positive and no mask. Oh, well, there's 80 people in there that get it and 0 in this. Where are we doing studies like that? Where are we even extrapolating that data?
Well, Chris, I would have to ask you because you're the physician and you have all the answers.
I don't know. I walk among heroes and I listen to smart people that I work with, and I'm on this task force calls as much as I can. And there's a couple thousand people on there, smart people up and down the East Coast, and they some of the things that are said are just that. They're conjecture. They're just like this. We know it's a bronchitis. It's a cold virus. It's a coronavirus called novel because it's a new coronavirus. COVID-19 is the syndrome, not the virus. It's the syndrome. But the virus, I believe, is called corona SARS-19, SARS.
Right.
It's a systemic adult respiratory syndrome. So we know some things that work for that. Steroids, beta adrenergic steroids like albuterol. We know that oxygen helps. We know that sometimes it can cause multi-system problems, myocarditis, nephritis, pneumonitis, where it allows the blood to mix with the oxygen in the little air pockets called alveoli. And that's really where people go downhill. That's SARS. That's systemic adult respiratory distress syndrome.
Yeah.
That's a bad situation. And that's why we're proning people, because we can't keep the fluid out of their lungs. But we also know that some high pressures sometimes work for that. CPAP and BiPAP into the lungs, sort of force the balloons, those little alveoli, push the water out, but not too high a pressure or will damage the lungs. So it doesn't surprise me that steroids help you.
Yeah. Chris, could you explain to the people what prone position is, those who maybe aren't have a medical background and don't know what that means?
Yeah, so when people are intubated, when they have a breathing tube down their trachea to breathe for them, they're almost always on their back so that we can listen to their lungs, we can put IVs in them, we can do an eye exam, make sure they're awake or not. But that allows more fluid to settle because your lungs actually go down your back about 6 inches more than they go up where your ribs are. So if we put people in the prone position, the fluid goes to the smaller part of the lung, which is about that much, and it leaves more of the top or the back to aerate. So oddly enough, that's one of the hallmark treatments for people. We're putting them face down, turning their head, putting them on pillows so that the ventilator's like this, which is almost unheard of.
Right.
But boy, everyone's doing it. So to me, some of the real heroes, I don't want to discount my own colleagues, the physicians and the nurses. They certainly are, to me, putting themselves in harm's way. But honestly, it's the respiratory therapist that are turning the patient and grunting and pulling their PPP or personal protective equipment off and moving big patients. And it's the gals and the guys cleaning the rooms after a COVID patient or after a PUI, a person under investigation for COVID. And they're coming in clean the rooms to get them ready for the next person. Those people are really the unsung yeomen. They're rowing the boat. They really deserve a lot. Respiratory therapists, room, the people clean the room, the maintenance, all of those people at the hospital. They're top notch.
Yeah, I think you're exactly right. And there's a lot of times they're not getting the credit that they're due, especially during this current pandemic situation. A lot of people take that for granted. People who, especially, the cleaning services, the people who come in and clean. I mean, me being in the operating room in between cases, I mean, if they don't clean that room, obviously well, like they're supposed to, infections go up. Same thing for exposures for COVID-19, because, I mean, how long do we really even know how long this stuff lives on the surface? They told us 12 hours if it's on copper, then they went back and said, no, that's not true, and a doorknob and cardboard. And so, the respiratory therapists are way undervalued, I think, as other healthcare professionals right now.
Well, and Brandon, we ought to probably also say that just because a virus is living doesn't correlate with transmission or disease transmission. So right now on you have staph and strep and MRSA and viruses and ringworm. Guess what? It doesn't. So this stuff that it's on cats and it's on your shoes and it's on, I mean, my goodness, let's put some perspective on this.
Right.
I'm not saying it's not a bad disease. It's a dreaded disease and it can take down a lot of people and it can overwhelm the system. But I'm not sure it's overwhelming the healthcare system of the United States. Our goal was to not have a peak in 8 weeks of, there's 320 million people in the United States, about. So 320 million people, 85% of them that get it on this bottom part, they do well, they're asymptomatic or mild. Another 9% on top of that, 85% are moderate to severe, like you, like they have to stay at home, they're out of work, they have to convalesce. And the other about 5% need a higher level of care. Oxygen, hospitalization, antibiotics, ventilation, or death. So 5%, that's why 5% of 320 million people, I mean, that's a significant amount, right? I mean, that would overwhelm the system. But really, we probably realize that those numbers are not that much.
Right.
But there is a susceptible population. It's the old, it's the elderly, it's the comorbid. It's predictable to a point. So I think we can do a great job, and we are, protecting those populations that are at risk. We're not allowed people going to hospice houses. There's no visitors from nursing homes or to assisted care, or even limited, to grandma and grandpa's house, because they're not fighting the disease as well. So,
are you able to, in the emergency department, are you guys able to administer a rapid test, or is it a send out?
Well, it all depends. There's several different tests. So there's I'll go for the rapid, and I just know the drug company, not that I work for them or have any stock in them, but Abbott has a rapid test. It goes about a pinky into your nose, and that's a little bit of an over test because it tests the coronavirus particles too, even when you don't have a live virus. So in 10 days, you shouldn't be shedding viruses, but you might be positive on the Abbott test.
Yeah.
That's quick turnaround. The next one goes all the way in and has to stay in each nostril for 10 seconds, and that's a PCR, elimination chain reaction, and that takes a little bit of time depending on where you are and what hospital has the PCR machine and the assay. And so, here in North Carolina, it was really only LabCorp in Burlington. It was getting all these, that's their headquarters. So they're getting all these things sent up, and they're just stacking them. And that's why it took 2 or 3 or 5 or 7 days. But now many companies, through a federal government, through the CARES Act, is lowering the price and subsidizing smaller hospitals such as Iredell or Levant or Doctors Care or CVS to even run these things.
Yeah.
So we're really doing a good job. From my understanding on the task force calls, we've gone exponentially up to the capability to run tests.
Have you seen the data out there that shows? I don't know if it's the rapid, or the send out, but it's either 25 or 33% of negative tests are actually positive. There's a false negative out there. Have you heard that?
I've heard lots of things. I'm not certain I could substantiate many things.
Yeah.
Yeah.
So it was interesting because not only did my physician, but pediatricians and whatnot had explained that to me, that they're not seeing as many false positives, but they're seeing false negatives. So if someone in your household were to say, for instance, you and I live together, I'm positive, you go get tested, 3-4 days later, you're showing some symptoms, but yet you come back negative, that we need to treat you as if you're positive, because there's no way that we're in the same environment, exchanging air and living quarters, that you would not get the virus. So I thought that was interesting.
Well, there's a lot of interesting considerations. One of those is the false. Look, any test is not perfect. You can have false negatives and false positives. You have sensitivity and specificity, we call it in medicine.
Mm-hmm.
If you can just Google and look up overcalls. There's many overcalls. And are we, by giving these tests out to not only the health departments and the hospitals, we have two sort of systems here, the Atrium system and the Nirvana system. And now CVS is doing it, and Doctors Care, and now Gaston County, and now some of the smaller hospitals surrounding you. Are we getting accurate data back to DHEC? If you go twice and you're positive, are we counting you as two different cases? I think there's good data to suggest that we're overcalling it in America.
Mm-hmm.
And there's good, look, we have 320 million Americans-ish. Census is this year, but we're 128th of the world's population. China is 1/5. India is another 1/5. Yet the United States, who's 1/28th of the world's population, we have 25% of the cases of coronavirus and 20% of the deaths. You're telling me that the United States of America, with 1/28th of the world's population, has 25% of their cases. What might that suggest?
Could it suggest that other countries could be possibly underreporting or not reporting, Chris?
Huh. Brilliant deduction. So I think on the World Health Organization, we are behind Bolivia,
Yes,
maybe even Brazil and other countries for neonatal deaths, which is a marker of the healthcare system. Do you really think that we're behind Brazil and Bolivia? No, it's that they're not reporting it, and we're over-reporting it, and they're sending people here from Saudi Arabia and Canada and UK and the proletariats of the United Kingdom to come here because we have a great healthcare system. So I think some of this data we need to, it's not just like we should be looking on the shelf and say, oh my God, Brad Pitt and Jennifer Aniston, who cheated on who? There's a story behind it. And to jump to deductions, and worse yet, to jump to deductions and to judge other people.
right.
Maybe it's presumptuous.
Yeah, I think you're right. But depending on I try not to watch and listen to too much, but that statistic that you were talking about with us being so behind on testing, but yet we're leading the world in positive tests. Like you said, you kind of have to dig a little deeper when you look at something like that, when you're comparing us to India and to China and other places.
And I think it's important to consider. I'm not saying it's not a bad disease.
Right.
Just saying the numbers, you can report a number. Going from 1 positive to 2 is a 100% increase. So
Right.
if you say that we're on a 100% increase, oh my gosh, we've doubled the cases. Yeah, but now if we go from 1 million to 2 million, that's a big difference. Does that make sense? That overwhelms the system. So I think we just need to be, some of the nicest descriptions I heard was just be kind.
Yeah.
Be kind and
Well, I think people can also help themselves by, look, I was wearing a mask when I was going out in public. I was using hand sanitizer and I was washing my hands. Just before my diagnosis, I started taking vitamin D. I was taking vitamin C. And then once I was diagnosed, I added in zinc. That's supposed to help. And even melatonin is supposed to have some benefits for immune boosting, sleeping, and antioxidant. I can't even say the word, antioxidation. There you go. And supposedly helps decrease or stop the cytostorm or something that happens.
Cytokine storm. Sure. That's the destruction of your body, sort of producing your own inflammation. Cytokines are cell killers. So, strep's about. And let me say this. I mean, somebody, hopefully they'll Google this while we're talking, or as you post this. But I think there's been last year, 500,000 deaths because of tobacco in the United States alone. 500,000. How many deaths of COVID-19 in the world? About 500,000 to 600,000.
Yeah.
Right. That's a beautiful. So let's put it in perspective. Maybe we should be shouting and wearing masks and fire extinguishing people with cigarettes.
I maybe, but then it's personal choice, Chris. If you want to smoke, you have to smoke. But it's not a personal choice.
Let me get my tobacco pipe.
That's right. Exactly. There was interesting. I was listening to a podcast last week, and I don't know if this is true because I was trying not to die and I didn't Google it to fact check. But it said that 1.5 million people across the world died of TB last year. And, there was and TB, as you know, is highly communicable and it's a horrible disease. But even in the U.S., there was an uptick of confirmed TB cases in 2019. I don't know.
You bet there was. And that's well substantiated. TB is a killer. It's highly communicable. It's aerosolized. It's close contact. And it's because we have been decreasing the amount of TB testing and follow-ups.
Interesting.
Yeah.
It's interesting that gets no real coverage, in the news.
Are you suggesting there's some political gain or?
I mean, yeah, as it would be, yeah, exactly. Yeah. But I did want to, so, outside the emergency department, you have your own weight loss clinics, but what's interesting and what I think is great about what you're offering something, if people come to your office, they don't get tested for the virus, but you have a test that you can offer to see if they've built immunity. Is that right? Or if they've been exposed?
Yeah. So let's think about a graph, right? Let's say right down here, and this is days. On day 0, you infect me, day 0. But pretty soon, so I get 1 virus particles, 2, 3, 4. It builds up exponentially. 2, 3, couple days later, 4 days, you're feeling crummy. There's viral replication. Typically, what we understand from coronaviruses and COVID-19 itself, the viral particle is replicating so fast that it peaks about day 7. And those days are highly infectious. From day 0, you don't really feel it. Day 2, day 3, day 3, now you're starting to have viruses. They're replicating in your lungs, maybe in your cardiac area, in your blood. So day 7, you're feeling crummy. Then you start to go down. And then about day 10, so again, day 2 or 3, day 7 peak, day 10, you're not probably really viral shedding unless you're very sick and you can't fight it. Now, these are generally exceptions. Some other people can be 30 days. But a young, healthy person, such as yourself, should beat it in about 10 to 12 days. Then why do we say 14? If at 10-ish, 12, there's a fudge factor.
Yeah.
Let's be sure. So then you start to produce antibodies, 2 different types of antibodies, IGM and IGG. And that's what we test for. It's helpful to know that hey, back in February, I was feeling crummy. Back in March, man, I had this, and we didn't know what COVID was.
Right.
So what we're doing is a little finger prick stick. It's as quick as like a pregnancy test. We take 2 drops of blood, put it in a little cassette, drop some assay in there, and we all count and we say, yeah, no, no. And within 30 seconds, we can find out whether you have had COVID-19 and I don't want to say you're immune, but you have antibodies.
Right.
The IGM or the Marines that come on first, and they come about day 10, and then they drop off maybe 20, 30 days later. And then long lasting is IGG. Now that's what we hope to have build up in your system, my system, and everybody's system. That's resistance. That's what we vaccinate for, so that you recognize either a dead virus or a live virus, such as polio or DPT or HPV, so that we give you something that you build up antibodies. What we don't know is how high those antibodies are that confers long-lasting immunity, or how long you keep them. So when people talk about a vaccine, I think we need to be very, let's take polio. It's a virus. Deadly virus back in the 40s or 50s. I have an uncle who was in a wheelchair because of polio. And what do we have to do? We give 1 shot, and it's a panacea? No. We give 2, we give 3. We have to give several shots, because 1 vaccine confers immunity, and I'm making a number up, in maybe 95% of people. Oh, that's good. No, that's not good. 2 shots confers enough antibodies to have 99% of the people have resistance or immunity to it. That's good. No, that's not good. 3 shots. Wow, 3. That's why your kids get vaccinated a series, and in essence, it confers immunity forever with polio.
Right.
So I don't know. I'm not a virologist, and I'm not an epidemiologist, and I'm not a benchmark person. But what do we have to do for tetanus? What do you do all the time? You have to give up.
Well, I mean, we get a tetanus shot every 7 years. We have to update it.
So we have to give a booster.
Yeah.
So what happens for tetanus is a different thing. And what we do is we have to give a booster about every 5 to 10 years, because our IgG, they're good. Hey, they log up. Okay, wow. Then we have to give it again. And then what do we do for a virus such as influenza? We have to give that every year, because it's rapidly evolving and changing.
Right.
So it would surprise me very greatly, Brandon, if there is this 1 shot. I got 1 shot to make it. That it's going to cure things, and 5 days later you're going to be vaccinated, fully vaccinated, and you go out. So Moderna, Pfizer just got $2 billion from the federal government through the CARES Act to start their testing. But I don't think it's going to be like we'll see.
I think Bill Gates said this last week that be prepared for multiple vaccinations, right?
Oh, did he say that?
I believe I saw a headline of that somewhere. Yeah, and I don't think it was on the Onion. So.
Okay, yeah. So just I didn't realize. Oh, I'm up there with Bill Gates. He's a bright guy. And what he's done is he's created funding so that we don't have to build a vaccine from the ground up. We don't have to build it from a car design. What he's done is he's given hundreds of billions of dollars, theoretically through the Gates Foundation, to have a chassis so that we can go RNA virus, DNA virus, new mutated virus, so that we can be 4 steps up the ladder.
When you say RNA virus, explain that. Dumb it down for dummies like me and everybody else who's listening.
Yeah, there's a couple different. There's cars and there's motorcycles, and they're both motor vehicles. Well, there's RNA viruses and there's DNA viruses, and they have different characteristics and speeds and death rates and onsets, and same thing with the RNA viruses. So they're just two different vehicles that act in some predictable fashions.
Mm-hmm.
Motorcycles are motorcycles, cars are cars. One's a little bit more stable, one you can have mutations more rapidly, and one you typically don't.
So if someone wanted to come to your office just for the testing, could they do that, or do they need to come to your office for wellness and weight loss?
No, you can come just for the testing. Yeah, it's a quick, easy, again, 10 minutes. You'll spend more time answering the questionnaire, taking a temperature, and washing your hands getting through the door in our safe office zones than you will doing the test. It's easy.
Does insurance cover it, or is it out of pocket?
Yeah, well, we will submit a claims form to you and your insurance company, which should be covered. Okay. Insurance companies, I have to give them their kudos. They're doing a great job of allowing non-pre-authorized testing for COVID. And so we'll submit you a claim, but pretty much it's cash out of hand, and then you can submit.
So if someone had to walk in and pay off the street, roughly how much does it cost to have the test?
It's about $150. We've given discounts to EMS and those frontline folks, nurses, and so forth.
That's $150 to have a little bit of peace of mind. I've spent $150 on a lot worse.
Yeah, I know you. Yes, you have.
So how accurate are the tests that you're delivering to test if people have been exposed or building some immunity?
Yeah, so that's a great question. They're very accurate because they're a simple A plus B equals C. Viral particle or viral antibody, which again, we're not testing for the virus, we're testing for the antibody, which is easier to pick up.
Yeah.
So, it doesn't have to go to a PCR, polymerase chain reaction. It doesn't have to be refrigerated. It doesn't have to go back there. Instead, it's the blood, which is the antibody, plus the assay, and within seconds. It's as simple and easy as a pregnancy test. That's what it is. It's a combination. So they're very accurate.
Good, because I think the pregnancy tests aren't 33% falsely negative. It's remember when we would see patients in when we would work together, you would say, so, what's going on with, are you pregnant? Well, a little bit. That was always one of my favorite answers at triage.
Yeah.
You're a little pregnant. No, it's either you are or you aren't. There isn't a little. It's it's.
Yeah. Hey, I'm going to drink a Diet Coke. Sorry.
Go ahead.
So yeah. You're. It's one or the other. You can't have both, right?
Yeah. It's like, oh yeah, I was a little pregnant, but now I'm a lot of pregnant. It's something that you mentioned about your viral loads and stuff like that. When you're starting to shed the virus, you're really infectious at day 7. What my physician told me, and he was spot on, was be careful and be very mindful of what you're doing on days 7 through 9, maybe even 10, because you could be feeling really well, like you think you've got this thing kind of kicked, but then day 7 comes and it's almost like not a relapse, but you really start to backslide. And that's when I started not feeling great again, and reached out to you guys too. We were texting back and forth, but not just for me, but that's when my wife started really having those respiratory symptoms. It was her day 7 through 9. So they were spot on with that. And I have we actually have a mutual friend who's a nurse practitioner, and she too said, watch out for days 7 through 9. And they were right.
Well, in the emergency department, this well, we can always, you can Monday morning quarterback somebody, and you can say, well, my doctor didn't see the rash yesterday, or even we didn't see the rash. But I want to point out to everybody, disease is a process. What was difficult to diagnose yesterday is now easy to diagnose today because, hey, the rash is poison ivy or it's chicken pox, and guess what? It got worse or better. So think of a gallon of milk, and you have it in your fridge, and you're like, you open it up, and you're like, I don't know. You drink it, it's okay. And then you leave 2 days later, you come back, you're like, whoa, now it's because all those bacteria have produced, and they produce rapidly. Einstein said that somebody asked him, what's the most powerful force in the universe? Have you seen this discussion? And he sits there for seconds and for minutes and 10 minutes and 20 minutes, and he ponders, and they almost think that he falls asleep. And he said, the law, not the rule, the law of simple compounding interest. Because what was 1 is now 2, now it's 2, that's 4, 4 is 16, 16 is 30. You see how quickly it rises. It's an exponential rise. Whether that's nuclear power, whether that's E equals mc squared, or F equals ma, or gravitational forces, when something compounds rapidly, when 1 becomes 2, 2 becomes 4, 4 becomes 16, like viruses and bacteria, they spread pretty quickly. So that's why you're like feeling pretty good on day 3 or 4. Boom, 7 hits. Whoa, you got a lot of viral particles. And it takes a while for your body to catch up.
That was a great way to explain that. Well done, sir. It reminds me of when you were a kid, your uncle, what was it, Vinny?
I have an Uncle Vinny, Tony, and Oswaldo. I'm Italian, eh?
Your Uncle Ozzy. This would be a good one. When they would say, hey, if you want to mow the yard, I'll give you $10 to mow the yard, or I can give you a penny, and every time you mow the yard, we double it. So now it's 2 and it's 4 and it's, by the end of the year, you've made over $1 million by taking that penny on the first because of the compounding interest.
Yeah.
Yeah. I'll be damned. One thing that you were talking about too about bacteria and virus, and you even touched on it, was HPV. And this is kind of like a men's service, public service announcement that throat cancer is real, and there's a portion out there of men who get diagnosed with throat cancer, and it's because of they're exposed to the HPV virus orally, right?
Yeah, so the 3 leading causes of throat cancer, it's almost always something that insults or causes harm to you. You don't just get throat cancer. It's not a cell that gets cancer without an insult. Mm-hmm. It's alcohol, tobacco, or HPV. And before 1992, we didn't know what caused throat cancer. Now, Jim Kelly, the quarterback, 4 straight Super Bowls, he has throat cancer. We know it's HPV type specific. Michael Douglas, we know that it's HPV type specific. So probably
Val Kilmer.
Somebody else too, just recently, and I can't.
So Jim Kelly, for a moment, he was, if I'm not mistaken, he was a dipper. Was did his for sure come back from HPV? I mean, either way, he was introducing toxins and trauma to the throat. But
yeah, we know that it was an HPV specific. There's, and here's how we discovered this before 1992. Nuns rarely got cervical cancer. Nuns, Catholic nuns. Well, theoretically, they don't have sex.
Right.
So now we start to think that there's a link, and this is what epidemiology does. It should study, hey, bald guys with no hair get skin cancer. Cubs fans lose World Series. Sorry. But you guys beat my team, so, so there's characteristics that we study. Then we started to understand that cervical cancer is linked to throat cancer. It's a transitional cell in your cervix, in your vagina. It's a transitional cell here. Different cell type, but very similar. Very susceptible to the same virus. So now guys that are having cunnilingus, that are, having oral sex, are getting throat cancer. And go figure, Michael Douglas has clearly come out and said, I got this by oral sex.
Also, it could transmit from men to women. Is there an uprise in women throat cancer? Men.
I have a personal friend that she has throat cancer, and I'm uncertain whether it's, since she's married, I don't know if she wants to say that it's HPV specific,
Sure.
but she
Well,
certainly
could
has
have been a
got.
tobacco chewer. She could have been dipping or chewing.
She could have been
Yeah, let's not
cracking and coking, and
Hey,
kindness. I judge not. Kindness.
kindness.
So and you could have it for years and years and years and years. Quite honestly, now they're vaccinating young girls and young boys for HPV.
Right. And what is it, about age 12? Because I have 2 children. So
Yeah.
I think is it at age 12 they're saying that is that the age that you want to get them vaccinated? It's is it Epigard or
Epigard, yeah.
Epigard shot. And it's for boys and girls, right?
3. It's for boys and girls. Initially, they were only doing it for girls, and then they had some stage 3B clinical trials on boys, and it decreased. Well, why not? Why are we doing that? I've become a little misogynistic. There's women's health towers, and where's the men's health tower? Why aren't we vaccinating boys too? If it saves lives. So yes. So since 2008, I believe we started vaccinating. I'd have to look at the studies, but or the vaccination tables. I'm sure a pediatrician knows it right off, but it's before they're sexually active. You get a series of 3 because 1 confers immunity to a certain high percentage of people. 2 confers immunity. 3 shots in essence confers lifelong immunity without a booster for everyone. So
that brings me to a question. If you want to give it to kids, or you can give it to your kids if you so choose, before they're sexually active, what if you are a grown adult who is sexually active? Can you still go get the vaccination then, or no?
From experience, people aren't going to, the insurance company is not going to pay for it. But if you are sexually active and you have a lot of oral sex, I would highly recommend it personally. Epidemiologically, I'm not certain that it confers saving lives because it hasn't been studied in that population. But if you go from single or married to divorced, and now you're woo-woo and you're having a great time and you're eating,
Sure.
Yeah.
You're enjoying it.
Yeah. You're having I would recommend it.
Everyone's being kind.
Yeah. If you're a giver, someone's a taker.
So would it be safe to say that, let's say that you've had fun and you get married and you have all these HPV villains in your body, but they're dormant, okay? And let's say that none of them attach and you're good, like it's never going to show up. But then if you get this vaccine, you build this wall that doesn't let new HPV penetrate. So I guess, is that kind of like the theory is the HPV that's already living in your body because of all the kindness that you were giving to the world before, the hope is that it's not going to grow into throat cancer. But
and we don't know that.
Right.
But why not? Why? Everything is good. Science, it has to be proven, but science is also inherently subjective at its roots and its beginnings. We see that right now. We see that right now with COVID. There's many, we're giving steroids and we don't know that it works, but boy, we know it works for other coronaviruses and other inflammatory pneumonitis and bronchitis. We don't know that remdesivir, an antivirus, works for it, but we know that it works for other viral, so until it's proven, I think personally it's something good. I've gotten.
Is there any harm? Well, okay. So is there any harm to a sexually active adult getting the vaccination? Is there any harm?
I'm not aware of it. I personally, I'm not aware of it because I got it. I got the vaccine I'm 52, so I got it at 50. Gee whiz. But here's the harm. my insurance company denied it, so I had to pay $225 for 3 times.
Well, even so, I mean, you'd rather spend $1,000 or $500-700, whatever it is, as opposed to looking like Val Kilmer.
Sure, and we spend $1,000 on our teeth, and and it's denied. So why wouldn't we, for what I would presume, it's an insurance policy, and to me, look, there's some very poor data that, and I love Jenny McCarthy in many ways, but there's 2 things that have changed the trajectory of human population in the world. Do you know what they are?
Vaccinations?
Well, let's see. Money, nuclear power, antibiotics, having a pet, a cat and a dog. No, 2 things: clean drinking water and vaccinations. Where you instill clean drinking water and where you start a vaccination program, longevity of human life goes off dramatically. I don't have the numbers until something else sort of takes it, but it's a jump. In 3rd world countries that don't have access to that, the general population, or historically throughout human history, we didn't live as long. Those 2 things save lives, save populations, have reversed the course of death, morbidity, and mortality in humanity. Nothing else has done that. Not fire, not protein, not a diet, not antibiotics.
And there's still folks out there who are firm anti-vaxxers, and it seems like that we did a whole show on this about 1.5 years ago, but it just seems like even now, I think with this, the talk of there being a vaccine for COVID, there's more people. I think there was a stat that was put out last week that I think it was still leaning in the favor of people not getting the vaccine as opposed to people getting the vaccine, because they weren't believers in it. And again, don't anybody ever listen to anything I say, because I'm most of the time a dumbass. But
yeah,
check on
and
that.
Brandon, we're gonna withhold the COVID-19 vaccine because I don't know about that yet, and I don't, and it's such a rush to production right now.
Sure.
So I'm not going to count that. I'm telling you the historical perspective of HPV, polio, diphtheria, pertussis, tetanus. Those vaccines absolutely save lives. And they're now where people do have a point. If you give somebody too much oxygen, you can kill them.
Sure.
If you give somebody too much water, you will kill them. If you give somebody too much warmth or cold, you'll kill them. So if we give enough people vaccines, the side effect of vaccine is now higher in the United States of America than the death rate or the morbidity or problem rate of the vaccine disease. So does that make sense?
Yeah.
So when people like let's say I'm not going to get my kids vaccinated because I'm whatever that one group, I'm a chiropractor, I'm a holistic person, I'm a Jehovah Witness, and I don't know if any of those groups.
It's just theoretically speaking.
They have a point that, hey, getting my kid vaccinated right now in America is more risky than getting the disease itself. They have a great point. However, what you're asking everyone else to do is to take the risk for you.
Yeah.
Does that make sense?
Sure.
So it's a little bit selfish considerations. That's why we have outbreaks of pertussis in New York City. That's why we have outbreaks of diphtheria. Does that make sense? Mm-hmm. Because now we're decreasing the amount of vaccinations. Now the disease is going to go up. So it's a seesaw. But overall, the thimerosal, which is the preservative in it, doesn't cause problems. I mean, it just doesn't. They're safe. They're safer than drinking Diet Coke.
You'll see the meme that goes around for folks who believe in vaccines. It'll say, if you believe in vaccines, why are you worried about my child? Because you're protected, right? And I just don't, I mean, there's a point to that argument,
Yeah,
but
I see the point.
yeah,
It's an actually mathematically statistical point. Again, you stand a higher chance of having a side effect from polio than you do from getting polio right now.
right.
But let's say if everyone started doing that, you're going to have small outbreaks. Now what you're doing is you're selfishly risking.
Yeah,
You're asking the rest of the population to take the risk for you.
sure.
There's very few things that I'm compelled to do. I'm a little bit of a libertarian, but vaccinations are one of them, excluding COVID-19, because all bets are off there. It could, who knows?
Well, I mean, just in the last 2 weeks since I've been experiencing it personally, the guidelines have changed. It was quarantine for 14 days, 3 days with no fever, improving symptoms. Literally days after, it changed to 24 hours with no fever, 10 days isolation. So, you know, I mean, who's to say things aren't going to change tomorrow or next week with this thing? They could go back. I mean, who the hell knows? To 14
Yeah,
days.
so I said something to my uncle who is 84 years old. He's in a wheelchair and he has polio. And I said, Uncle Si, have you ever, yeah, Uncle Si, you know, have you ever, I mean, these are crazy times. There's COVID-19 and isolation and riots and this life matters and that one. Have you ever seen anything like this? And without a hint, I said, I don't think our kids realize. He goes, I lived through this. Whoa, what do you mean? He goes, Christophe, you know, Christopher, I'm in a wheelchair. I'm like, oh shit. They sent him away to a sanitarium.
What?
Yeah. They sent him away to a sanitarium. So he has a hemiparalyzed lung. He had his head sticking out of a metal contraption for
The iron lung?
5 weeks. Yeah.
Holy shit.
So back then it was frightening. Back then we didn't know what was going on. Back then there were conjectures until Jonas Salk developed the polio vaccine and was hailed a hero. There will be a hero in this new COVID-19. And it will be a team or a man, if he's lucky enough, or a company to be the, you know, just like back then. I didn't get that until he said that.
Or it could be a woman.
Uh,
You sexist pig.
I told you.
You
I have 2
misogyny
daughters. I
asshole.
work with all women. Thanks for cutting this part out, bleeping this.
Oh, yeah. Yeah. But no, I mean, that's a good point that we forget about, that, you know, someone like your uncle who's 84 years old actually did live through this at one point, you know, and even with the civil unrest, and I wasn't around in the 60s, but, you know, maybe there was protests then, there was gassing, water hoses. I mean, things were probably pretty bad back then too. I mean, in the 70s, there was the gas crisis. So, I mean, we've all lived through other generations before us because, you know, we're all selfish. It's all about now. Nothing ever happened previous. Generations have all been through all types of shit.
But at least they had LSD back then. I mean, that really made things better. We just have bad toilet paper now.
Speaking of, if you can find toilet paper, why do you think I'm wearing this thin shirt? I've got diarrhea. So I was, you know, on quarantine, there's not a whole lot you can do. So I was watching a lot of Netflix, and there's this new documentary out called something about drugs, but it's like cocaine, heroin, and it talks about psychedelics. And there is a study going on. I think it's up in is it up in Washington State? Any rate, I can't remember. Doesn't matter. Watch the documentary. It's on Netflix. But they're taking these military guys who are suffering from PTSD, and they're putting them in a controlled environment. These are guys who have attempted suicide or are really in a bad place wanting to commit suicide. And they are putting this in a controlled MDMA environment, and they're giving them MDMA. I think it's three treatments, and they are not as depressed. They no longer want to kill themselves. It's almost like it's setting a reset, something in their brain to where they're not, I don't want to say they're not clinically depressed anymore. They did a story on this one guy, but it's really interesting to see how hallucinogenics were used back in the good old days to treat things, but then it was deemed the Schedule 1 drug, and now you can only get it. I think cocaine, heroin, no. I think cocaine's actually a Schedule 2, but marijuana is a Schedule 1.
They used to have cocaine in here. Hold on.
Yeah, that's what made it so addictive, right? That's why we loved it.
Yeah.
But check that out. I don't know about the, but it was the hallucinogens that are helping these people who are having depression, suicidal ideation, PTSD. They're seeing some good results. I wanted to say it was 3 out of every 4 improved.
Hey, shoot that to me after we're off here.
Yeah.
That interests me. You know, what does MDMA do? It increases in your, I don't know, I'd have to go back to, it increases your catecholamines, your norepinephrine, your epinephrine, hey, I feel good.
Feel good.
You know, yeah, I would like to.
I'll send it to you. I think it was the 3rd episode. I was sitting up one night because oddly too, with this COVID situation, I had insomnia. I couldn't sleep. I don't know if it was something from the virus, or maybe I was scared that if I fell asleep, I would die and wouldn't wake up. That could have been it. I don't know. But I'll shoot you the link. It was really interesting too, to look at that. I've never taken any hallucinogenic drugs. I am too much of a control freak not to be in control. So the last thing I want to do is take some sort of medic drug to where I'm seeing freaky stuff and that I have no control and I can't stop it. Does that make sense?
Yeah, I mean, although I have seen you with a whiskey in your hand or with the beer.
Yes, but I feel like if I just get up and walk around and drink some water, I might be able to tame that beast.
There you go.
But if you start, what is it called, chasing the dragon? I don't know.
Yeah.
I don't want to go down that road, man. Not at all. Speaking of something healthy, you also as hallucinogenics, you told me that you'd been doing something called F3. I've heard of it, but I'm not that familiar with it.
Yeah, so 6 years ago, I got divorced. I never saw it coming. And some guys in my neighborhood, I was having a rough night. And I lived in Huntersville, and I was walking out on the golf course. And, you know, they just knew I was down. And everyone had a combination to my garage to, I'm just an open book, come in and borrow the lawnmower, the power this, the power washer. Next thing I know, those guys are standing at the at the base of my bed saying, "Come on, man, bleep and bleep, get up." What the heck? They're lucky they didn't get shot.
I was scared to say, you're a hunter.
Yeah, so at 5 a.m, everywhere in the United States, it's worldwide now, but started right here in Charlotte, North Carolina, F3.
So wait a minute. F3 originated in Charlotte.
Yeah. And it's 2 guys that like to exercise, and they found fellowship and enthusiasm in it. So then they brought in a 3rd guy and a 4th guy and a 5th guy, and it became this little sort of cohort. And they say, well, Brandon, you do the workout this week. Chris, you do the workout, or you do the workout today. Hey, you're a Wednesday guy. You do the Wednesdays, you do the Thursdays. Then it grew, and they grew from Charlotte. Then it went to Charleston. Then it went to Virginia, and then somebody moved to Minneapolis. And it's called Faith Fitness Fellowship, and it always starts this way. Well, number 1, it's got some basic tenets. Number 1, it's free. Number 2, any man can come. Number 3, you start on time, you end on time. And number 4, I don't know. It's just what it is. There's a leader. We call him a Q. The workout is called the PAX. After you come your second time, you get a stupid name, like I'm Cookie. And if you don't like the name, don't ask for a new one because it'll be dumbass or ball sweat or
Is your
asshole.
name really Cookie?
That's what they named you. You don't get a choice.
You look like a cookie.
Yeah, I look like it. Oh, they're not very imaginative. It was DiOrio Cookie. You get it?
Oh yeah.
So so I went today. It's usually at 5:30 to 6:45 every day except Sunday. And so you start out with just a little. Some guys leading it. There may be 12 guys. There may be 20 guys. On a Saturday, there may be 40.
Wow.
But now we social distance, right? So they have stupid names like a jumping jack's called a side straddle hop. A push-up's called a Merkel. If you shake your hips, it's called a J-Lo. If you spread your legs, it's called a Jane Fonda. If you, stupid things, low flutter, high flutter, and you just do what you want. Start on time, end on time. At the end, you sort of get in a circle and you say, hey, anybody have anything that they want to say? Anybody need a prayer, any brotherhood? I don't really say anything. And then you say, hey, help me to be a better father, help me to be a better husband, help me to be a better dad and a better human being. Let's pray for kindness and happiness. And it doesn't matter what God you're praying to. And it's become this thing for me where I've gone on hunting trips with people. I've run the Blue Ridge Relay with a team. I've run from Charleston or Columbia to Charleston. There's a Kentucky bourbon run where we just do it. You say, hey, I like bourbon. You like it that much to run 216 miles? Yes, I do. Okay. There's one that's from Raleigh. It's called the Tuna Run. You run from Raleigh all the way down to what's the ship in that's sitting outside of Wilmington?
Wilmington?
Yeah.
It's not the USS Wilmington. It's called
is it the Wilmington?
I think it is the Wilmington.
Well, you run there and you have a little party and there's hundreds of people. So it's had a lot of meaning to me. I highly recommend it. Look, and I have daughters and I work with 50 women, but it's not helpful sometimes for a guy to say, hey man, let's go out and have a beer.
Yeah.
When you're struggling, which we all do, this has fellowship and it has meaning to me. It's one of the few things that I would say it's been one of the more powerful things that have changed my life as an adult.
That's a great point that you just made about that, because it's not always helpful if you're in a low place or something's going on. Everyone deals with stuff, right? To go out with a buddy and to go get a beer. Drinking, obviously there's no answers in the bottom of a bottle. Some people can't manage that well. But doing something positive and good for not only your mind and exercising and releasing those endorphins, but also your physical being of doing stuff healthy it's like a dessert with the sprinkles on top. It's a double whammy. It's good for you in both ways. And I can see how also building a relationship in a positive environment, faith, fellowship, fitness, as opposed to drinking, spending too much money, HPV exposure, all those things that you're going to do at the bar with your buddies, so no, and I think that's great. And I also think it's great that you have had that positive impact, but you're not afraid to share it and let other people know that there is something out there for them that's something positive. How do people around the country find out if there's an F3 group near them?
Yeah, look up f3.com. F3.com. We're up here in Lake Norman. It's LakeNormanF3.com. Or they can call me. I mean, it's a great. I'll tell you about my story. When they came and got me, like I was up all night on the golf course walking, and I'm not a suicidal kind of guy, but I was in a bad way. A couple things happened to me at that time, and they knew it. And I have a good. I'll tell you what. I have the best friends in the world. I mean, those guys, many of them, they saved my life. So they came and got me. You start running at 5:30. I was in no shape to run. was up. I was emotional. I'm a new guy. There's like 15 guys there, and they know the workout. I'm just in a zone of just going through the motions. I start to run. It was at Discovery Place Kids is where they meet for the Huntersville group at that time. 5 in the morning. It's dark. I just start running, and I trip over a curb, and I bite my tongue. So I roll. Actually, you just run. There's no weights. There's no things. Maybe you have a couple bricks or a sandbag hidden someplace or a big old tire. There's no really stuff you need. You might carry each other, right? You might help each other stretch. But so I tripped and I bit my tongue. I was not only just in a bad way, I was embarrassed. I was ashamed. Now my tongue's bleeding. And in the darkness, I am broken. I've never told this story. I was broken, man. I roll into the street and this guy, he goes, "Hey man, you okay?" He grabs not just my hand, he grabs my forearm. And he said, "You're okay, man. Come on." And he tells me his F3 name and he pulls me up. He goes, "We got you." Pats me on the back and I'm like, whoa. And I came back the next day. And then the next day. And now I don't come every day to this group, but if there's a new guy in the group, I make sure I come up to him and I say, "Hey man, I'm Chris. They call me Cookie. Welcome." Because I had tears rolling that no one saw it. I had blood in my mouth, swallowing it, shameful, embarrassed, and tears rolling down my face in the dark as I was running. I don't even know how I didn't. So that's my story.
That's a great story, man. I mean, look, you're a doctor, you're a successful guy, you are a family man still. People look at you from the outside and they see someone who has the picture of having it all. And we all have a story. And the fact that you're willing to share that story, and I think it's good that other people who may think, everybody has their own bags of shit that they carry around with them. And luckily for you, you have an incredible group of friends that were there to pick you up. And now you also are that friend who's there to pick other people up, even a complete stranger. There's going to be a time, and probably already has, that there's going to be a new guy in that group, and you're going to see the pain that he's going through, and you're going to recognize it, and you're going to pull him through. You're going to be the guy grabbing that hand and forearm.
I hope. Pass it on, right? Pay forward.
Pay it forward. Absolutely. Well, Chris, I don't really know of a better way to end this than that. I mean, what a great story, man. You're still one of the best human beings I've ever met on planet Earth. And we do have a great group of friends, and I am grateful, and I cherish each and every one of our friendships.
Hey, man, me, same thing. You took the words right out of my mouth. I love you, brother. Hey, thanks for getting this message across. And, appetite for discussion is a great medium for just all things good. So well done.
Hey, man, I appreciate it. And also, I'd like to text me or send me some information of how folks can get to your Charlotte office, your Charleston office. Do you offer testing at all of your clinics?
We do, and it's physiciansplan.com. Physiciansplan.com.
Physiciansplan.com. All right, cool.
F3.com for some fellowship. Only awesome. Dudes.
Only dudes. That's right.
There's a women's group called Women's Warriors too.
Oh, well, there you go. Okay.
Yeah.
Perfect. All right, Chris. Thanks, buddy. I appreciate everything. Love you, man. We'll talk to you again soon.
You. Hey, hang in there, brother. Bye-bye.
You too, buddy. Bye-bye. Hey, Chris, it's Brandon, man.